Hemant Gopal sir. Please welcome on stage sir. Today he will be present on oral therapy that can change the future of CKM syndrome.
Good afternoon, everyone. At the outset, I'd like to thank Dr. Ashutosh for bringing me here back. And I'm really thankful to the whole organizing team for just pushing this ahead. I had a flight to take. Thank you so much, sir, for this. And the topic assigned to me is today about a newer topic, what we call as the NLRP3 inflammasome inhibitors. And my target will be to consider whether this oral therapy can change the future of the CKM syndrome. So let us look into these. A brief introduction about the inflammasomes. If we see the body's innate immune response, we know this is the first line defense which is there, and it recognizes various patterns through the pattern recognition receptors, and NLRs, the nucleosome receptors, these are one of the very important PRRs which are present in the body. Now these receptors, they recruit the adapter proteins and form the inflammasome complexes that promote the maturation and secretion of the mediators like IL-beta and IL-18, which finally result in the inflammatory reactions. So if we look at this pathway, we see this whole phenomena. There is a complex which consists of NLRP3, the adapter protein, and the caspase-1. So whenever there is any cellular damage in the body, these molecules, they combine together, and this leads to the cleavage of the pro-inflammatory cytokines into the active form, and the whole inflammatory cascade starts. Now, how is this important here for us? Now this whole inflammasome, they can be activated by a variety of stimuli, which include various lysosomal destruction, mitochondrial dysfunction, and very importantly for us, the metabolic alterations in the body can lead to the activation of this whole pathway. And there has been seen that the overstimulation of these pathways contribute to the sterile inflammation which is seen in the metabolic diseases. So now coming to our specific topic, CKM syndrome, as it has already been discussed. So what I'll be focusing on is that the chronic inflammation is what is driving the progress across all these three organs. And the NLRP3 inflammasome is the key inflammatory pathway which is implicated in all these three components. So what is the role played by this pathway in the diabetes? If we see, this leads to or worsening of the insulin resistance through the inflammatory signals in the adipose tissue and the liver. This is the primary target which is affected. It also promotes the beta cell dysfunction and apoptosis here, and inhibiting this improves the insulin sensitivity and glucose tolerance in the diabetic patients. If we look into the specifically into the cardiovascular disease, as far as the cardiovascular system is concerned, this pathway promotes the atherosclerotic plaque formation through the macrophage activation. It contributes to the hypertension via vascular smooth muscle proliferation and endothelial dysfunction. And again, the inhibition, it improves the cardiac hypertrophy, fibrosis, and lowers the blood pressure here. If we specifically look at far as the renal aspect is concerned, this pathways again drives the renal tubular injury, podocyte damage, and again leads to progressive fibrosis. It promotes albuminuria, glomerulosclerosis in these patients, and again inhibition in the various CKD models shows the improvement by inhibiting this pathway. So we see this is the important pathway, and now we are working on the NLRP inhibitors. One of the prototype is the MCC 950, which is a very selective molecule, and it inhibits the ATP hydrolysis here and prevents the oligomerization in these patients. So there are various clinical effects which have been seen with this, that it reduces the renal inflammation, the fibrosis markers are improved, renal function improves. It has been shown to have a role in the CAPS, in the autoimmune encephalomyelitis, metabolic diseases. It reduces the IL-1 beta levels, and very importantly, it has an excellent safety profile. It does not affect the other inflammasomes. So that is again a very beautiful feature. Another molecule, Trenilast. This is a molecule which was earlier used for the allergic disorders, and it has now been recognized that it can act as a NLRP3 inhibitor, and it acts independent of the ATPase activity as we saw in the last molecule. So therefore, there is again a big list of conditions where the role is being studied, and it looks to be a promising molecule. Then we have another direct NLRP3 binders, which is a potent selective direct small molecule inhibitor of the inflammasome, and this again directly binds and again does not affect the upstream molecules. So that again leads to the specificity of these molecules. So these molecules have been found to be effective in the metabolic diseases, inflammatory diseases, various neurological conditions, as well as cardiovascular and even diabetic nephropathy also. So there is a vast area where we can find the usage of these molecules. Now why the oral inhibitors? As we see, it's a convenient daily doses. These molecules, high bioavailability is there in these molecules, and there is a potential for long-term chronic disease management with the favorable pharmacokinetics also. So all these features are favoring us. And there are again many newer molecules which are in the pipeline which will be helpful in. Now what is important is, as far now if we combine these two things, what is the primary role of these molecules? In the current strategies which are available, whether we are using the statins, the SGLT2 inhibitors, the GLP-1 analogs, what we have discussed till now, they are targeting the individual components of the whole cascade. But nothing is primarily targeting the inflammatory pathway which is leading to the progression of the whole syndrome. So this molecule basically intervenes in the upstream and prevents the whole inflammatory cascade. So therefore, this can fulfill the treatment gaps which are presently there in the CKM syndrome management. So there is a promising role, and there is a lot of evidence which is now coming up in their favor. Moreover, the safety advantages are already there, as we already discussed. These are quite specific, no damaging effects on the other immune pathways, and superior safety profile as compared to steroids or interleukin-1 blockage can be seen. So now if we convert these into the clinical trial, we need a lot of further clinical trials so that we can translate this knowledge, preclinical knowledge, into the clinical usage. And over a period of time, we will require better biomarkers to monitor them and show the results on the hard pointers like MACE or ESRD or hospitalization rates, so that we can bring these molecules into the clinical use. So if we look at the potential impact which they can have, if we just imagine a single oral pill which can delay or prevent the multi-organ progression in the CKM syndrome, nothing like that. It can be a beautiful thing to have in the pipeline, and this can potential to reduce the dialysis need, coronary revascularization, lower extremity amputations which are very common in the diabetic patients, and especially in the Indian population where diabetes is growing so rapidly, it can have a transformative effect in the society level also. So this we have already seen. These are again very cost effective also as compared to the potential biologics or the GLP-1 analogs, which are still quite costly in the Indian market. So therefore, if we look into the future, we can look into the combination of these molecules with SGLT2 or GLP-1 receptor agonist. We can provide personalized medicine approach through the screening of the genetic variants of these molecules, and even the pediatric CKM prevention trials will be required as there is an early onset in the Southeast Asian population. So I'll conclude that these molecules represents a paradigm shift in the CKM therapy by addressing the root inflammatory cause rather than the downstream effects of these inflammatory pathways. Oral agents can transform prognosis from reactive symptom management to the preventive disease modification, and urgent need for well-designed clinical trials in high burden population like India can be quite rewarding. So thank you all for a very patient peep into the future.
Thank you, Dr. Hemant Gopal. I can just a couple of quick questions. Dr. Gopal is scheduled to catch a flight at 3:30, so I can have a quick couple of questions.